here we go again. Difficult to talk, so bear with me. I found out, I can't remember what he's called now, written it down. This male called Richard, and I'm going to show you what this Millbrook Healthcare reference and inspection every 6 months policy nationally in the United Kingdom's changed. So, piece of paper. Well, it's upside down. I haven't got another camera to show you. So basically it gives a record of the manufacturer, March 2018. So it's not a year old yet. There's no need to replace it every year when it's working fine, by the way. And it's a Bridie, B-I-R-D-I-E, and the K weight, safe working load weight, 180. So the signatory of the previous one delivered an emergency, and what happened with that? It's called a PAT, P-A-T, and loader certificate. There's a loader, there's all these tests you have to do, and it has to be a specific individual trained in this. I've read up since an email came, 10th of January 2019 now. And this was Friday, 13th of all days, July 2018, and what happened there you wouldn't even believe. So I didn't want the same experience. Tuesday, it hadn't been my sister at the time, Tuesday 15th of May 2018, between 9 and 9:30. I had a verbal apology by the engineers that turned up to replace a damaged hoist. They only replaced it with another damaged hoist. So the original service, and good job I have paperwork, I won't get it all out. So, a male, I'm just looking at this, I can't even pronounce this guy's information, but the same individual guy called Gavin works in the same local depot. The depot location is Deport 85, Deport O85, correction. Basically, it's on the instructions to call me 30 minutes prior to arrival in a private location while there because of my complex situation and disabilities and trying to get to the wheelchair. You know, my back door, my wheelchair, the way my health is all this time on now is very poor. So one sort of clarification on my private friends' my behalf, because her immune system's really run down. Anyway, back then it was reference well, I didn't have any animals in here anyway, and this was dated a call handler, it's just a call handler in the call centre, and I've had people bang at my window before, and it's a lawful disability reasonable adjustments to, if you can't do anything between such time, is to, I've had this constantly, I mean before 2018, this has been going on for years. Wheelchair side in an area, medical lane, wheelchair service sometimes is okay, but it's always the OT department I get the problem with. And because there's intercom system, previous neighbours, it's gotten worse around here now, but would tell an individual to turn out and bang on my bloody window. No consent for that in my private location, by the way. So I could issue set this off under arrest. And I'm more extremely concerned because the head office is in Southampton, United Kingdom. It's been going, it's a lot, limited company. Now, I have a service reference number, so previous recent emails of this hoist offer service, and it's got the documentation under the address. I just signed it. Someone else, this individual, back on Friday, 2:30 in the afternoon, 26th of 5th, 2017. Back then, that was one of them, and this was dated 2018. My copy. It was sent to. I asked if the two men in the OT department, they call it Ramspenny, United Kingdom, department on emergency call out, and if it wasn't for my sister at the time, basically, as my sister said, I experienced still delays of extra period of months on to the call handler, the delay to repair to wet room. This is always the sign with the housing when you rent in UK, especially where I went from. The company, I should say, on the water flooring still. And it's not changed. It's 1 year and 9 months. The causes to my illness are making me worse. It's not changed, it's just got worse. And basically, she wanted to say a reference nature of that the hoist is left still safe on a temporary board flooring, and it's concerning still, but the fact that my sister had agreed to be on a live video messenger call as the individuals turned up with the replacement hoist and witnessed them doing what they did. 15th of 5th, 2018, and what I said, they took photos of my wet room. They weren't meant to be doing that. They alleged that, oh, we could speed this up for you. No, the words these men used were completely a set-up. Then I was concerned that it's affected onto my kitchen floor. It's all been going on. There's damage to my wet room, water, ceiling, and everything being rotted flooring. They won't do nothing unless I move out. I've offered the past year other adult health, social care, all these other public sector services employees, individuals I've been dealing with, and it's going around in circles, got nowhere to date. 21st, 1st, 2019 now. So, on the medical offer alone, of course, on this company, they're looking at their equipment, aren't they? Cost of equipment, and then the cost of public purse. Well, if it wasn't for the emergency, as I said, the number my sister called out hours for me and on the phone to me, helping me with this back then, I wouldn't have got replacement hoist. The male called what he did on the 27th of the 3rd, 2018. He also did a mattress elevator. I didn't realise he was going to be the same one that caused this major, serious, negligent behaviour of him by the 14th of the 5th, 2018. So, I've kept this as evidence, and the individual's call handlers are the same, guy called Alex, Gavin. Jim did not check my sling, and there's no reference to them meant to be checking it again this time for offer I offered tomorrow's date, you say, between 2 and 4. They never confirmed my emails. Again, delay. It's very hard when you've got a mouthful of ulcers to talk, let alone on the bloody phone to these people, and they keep getting to repeat yourself. So, the guy didn't sign his initials on this docket sheet, but I've kept a record of it, and it was meant to be a due maintenance, as I said. That was the mattress elevator. Oh yeah, the one with the hoist, so my sister had to call the out of hours. The out of hours reference number at the time was 4478482. Basically, he didn't check this guy called Jim, and he works locally. I didn't consent to him anywhere near me because of how he treated me. He was so abusive. And as I said, the time my sister called initially, and by the time the replacement came to me, the yellow sheet, a guy called Kyle, my sister made a call at 6 o'clock that evening because I didn't notice the damaged hoist at 2:30 until my carers come round and in the tea call, and I contact my sister, but what the hell, can't use it, can't transfer to bed, and that was their end game to like push me in emergency care. So they didn't like it, the fact that I had my sister on board. Called out of hours emergency number, and I had this yellow sheet said about me, right? It was unsafe to use, basically, and there's an email date here, 8th of the 5th, 2018, which nobody responded to then. They put on the records this guy called Carl, I ain't going to say his surname, and it's the same description, repair, no, it's a replacement. Anyway, they wrote down on this particular sheet, said that my carers were not happy using it. It wasn't the fact that we took pictures, and they refused to take the items that did no longer need to use, which they should have done. And that was a kitchen purchase stool, or two. One that's still in the wet room, one is in the kitchen, and other OT items I do not, well, can't use anymore, physically cannot use. So, they made assumptions on their words they wrote in pencil, and that's why I couldn't even thinking read what they read. And they didn't still even check the hoist, sling, which they meant to do. I would have thought happened before. So, community services will not be held responsible for redecoration of the property or any removal of installed equipment. They have this clause, the get out clause, in these documents. The equipment will not, the company here, in the event of an accident, injury arising from any use of such equipment prior to it being authorised by how they work now, occupation therapy. Any offer assessments is completely changed for all this time on to date. Cutbacks, UK, NHS, adult healthcare, you name it's going on. NHS England Limited, funded services. So anyway, this was a replacement of the damaged one done on emergency call out, and by the time they came was 9 to 9:30 at night. They made an apology, but it's deliberate the way they were just pacifying and taking the pee out of me on this document, the way they were in my own. My sister had witnessed the two men in my own by the live messenger video stream. As I said, what they said to me, or they said to her, 15th or the 5th, 2018. I will be recording the offer. I made it recent emails of friends of today that I will not tolerate any similar experiences what I've had before. And yeah, so-called maintenance of the hoist then, and I need a pick-me-up because I am down, so I can't sit all day in my wheelchair, and it's just unreal that this company don't treat disabled people with the courtesy and respect they need to make the dispute reasonable adjustments, you know. So that's why on 10th of the 1st, 2018, I had an email by their representative individual, and to book literally less than get my, just worked it out how they expect me to suddenly be available to suit them. So Thursday was the email, 10th of the 1st, 2019. My mate responded back on the day and offered the Tuesday to do the servicing of the hoist, the 15th of the 1st, 2019. That was rejected because they wanted to do it on the Monday. Unfortunately, I got commitments, and they didn't give me 7 days working days notice, lawfully meant to be, as a reasonable adjustment. So that email on Tuesday, 15th, 1st, 2019 never got responded to at all, because then that email was offered for Tuesday, tomorrow, 22nd of the 1st, 2019, 2 to 4, and it set the actual terms and conditions or condition acceptance offer, how to offer me the reasonable adjustments and my needs, especially the situation I'm in after what I've gone through already. I didn't get no response all week. Left it a couple of days. My mate sent another email Thursday, 17th, 1st, 2019, no response. I would have thought by the end of the working week somebody in the local office would email, and that was Friday the 18th of the 1st, 2019, and nobody did. Suddenly this morning, my mate saw an email at 9:30 saying they'd come out tomorrow after all and ignore the one I'd offered to Thursday. Well, all due respect, you don't treat somebody like this again. So all these handwritten notes, extremely concerning by the way they treat me yet again. So Millbrook Healthcare Limited, depot reference number 0805. And by the way, when I tried to call their head office number, it got cut off on me the Friday, so I couldn't get hold of anybody to see why there was no response, because I offered, as I said, a different date now, and it's only 2 days further down, and I'm very run down, very ill with all this thing going on in my body as well. So I had my friend emailed, and she'd emailed quick, but she got some dates and she got some words wrong. That's why the second email went out on Friday 18th, the 1st, 2018. You would have thought it went out in time for somebody to get back to me by the end of the working day. Or they didn't, or trying to leave it for them to get back to us. And nobody did, so that email got sent, and they closed their local offices at 4 o'clock. They must still be working to 5, but they don't respond to the public. So yeah, this is how they treat people. So this is, I don't know if anyone else experienced the negative treatment by them. And what I found is actually a PPM tech test had to look at this online and setting out my terms and conditions. So this was done as a notice to market acceptance of the offer. And again, the email got sent back in response to this individual's in his job role. He's not the service area manager. I found out somebody else. One's going to check that out. But the company for this company nationally is Southampton. Look it up, company's house. You find out who's who. 833-987. One's area is all interlinked with all these linked up services now as a terms and conditions of contract. But yet they're treating people with complex needs like I as a commodity, not as a human right, not as a dignity and respect. So I did a feedback online. I sought clarification and confirmation on my email to never treat me with negligent treatment again, ever. And most probably will, because they're just, because of what's happened before, I don't want it to affect me now. And that's what my concerns is, so I shall be streaming it. And they block off my data, cut my internet off because I'm streaming it. I bloody don't care, because it's my aim and my private dwelling, and I have a right to protect myself. I haven't got friends to be around during 2 and 4. They expect you to assumption you have somebody around. No, I'm so ill. I have to keep my door open in the bloody cold weather in the corridor because of it. It's set up with fake information again. That's what they keep doing. And they use, if you don't realise this, be careful, they use these individual employees to go feedback information without your consent, by the way, to others behind the scenes. I'm all for those safeguarding and things that's meant to be lawful and honourable, but they need your consent. Be prepared, they need your consent. I've got to go, I need to get some rest. But be careful, Millbrook Healthcare Limited or any company similar working on behalf of so-called public services, and be careful, it's your blinking aim and you've got your rights and they need to respect it. Signing out.